Welcome to The Way the World Works, where the trusted team behind the Tuttle Twins books tackles current events, hot topics, and fun ideas to help your family find clarity in a world full of confusion.
Hi, Katie.
Hey, Brittany.
So today I want to talk about health information and how it's becoming more decentralized. And by that, I mean how you're able to figure out or learn about I don't even want to say new things, but maybe alternative forms of health information that aren't just like the government handing down things to you. Because I remember, and you probably remember this too, like back when we were kids, did you go to public school? Actually, I'm not sure about
Yeah,
that.
I did.
Okay. So back in public school, like we didn't even have the food pyramid. I don't know if you remember, it was like 5 food groups or something like that. It was like before we could, all the information we had about nutrition, all the information we had about, health practices all came from like public institutions, right? It was the government giving you a list of things that were healthy, or your school telling you, what foods you should eat. And, now we know the government's food pyramid is so wrong. I think that's
Mm-hmm.
almost an understatement, right? We know that everything they were telling us to eat was not right, that, a lot of the time there's all this like high fructose corn syrup and everything, and it's because the government has all these like subsidies in corn that we know there's always like a
Mm-hmm.
weird reason. And so you couldn't always get that information, because when we were younger, you couldn't YouTube something. You couldn't pull up a
Right.
podcast. You couldn't Google. There was no Google. I don't know. How old
Mm-hmm.
were you when you started like going on the internet regularly?
Oh my goodness. I'm trying to think. I mean, honestly, it was like 1999 probably. It
I'm
was
trying
a
to
long
think.
time.
Years are like a blur. I was 11, 10 or 11, but we were very early adopters because my dad
Mm-hmm.
worked with like a tech nerd. And so
Mm-hmm.
we had like the America Online Disc. If you
Okay,
remember
yeah.
those, they'd be
Yep.
like 53 hours, and listeners are probably like, I don't know what you're talking. What is a disc? What is a CD-ROM?
Right, right.
It was old school. But even then, there really wasn't like a search engine like Google. You couldn't really go. But now it's so cool because now we're finding out about all these different methods of even treating sicknesses and illnesses. And this is something I think interesting to you, Katie, probably because we talked about before that you like to use more holistic treatments when you get
Mm-hmm.
sick or to stay healthy, right?
Yeah, and I actually had maybe a little bit of a different perspective even back a long time ago because my mom, for whatever reason, I guess she was like a pioneer, but she like took us to naturopaths and chiropractors even when I was a kid. So I was born in 1980. So even when like the food pyramid came out and when we were getting so much of our information from the government, and that's totally accurate, like we didn't really have like other places to look. For whatever reason, my mom was already keyed into some of it. So like we never bought into the margarine is better for you than butter. Like
Yeah.
she was always a butter user. So like I feel like I'm probably really lucky that she was, I mean, and I remember thinking she was so embarrassing and so weird. Like, it was so embarrassing. I'm like, why can't I just eat like, my friends eat?
Well,
She
back
was
then
like,
that wasn't as common. Right now, I feel like you have all these younger millennial parents where that's just what they do.
yeah, yeah, for sure. Yeah, I was
But
I was like such a weird kid. Like just the way that we ate.
That's so funny. My
Yeah.
sister-in-law, her mom was the same thing. She was kind of she did a lot of holistic stuff ever since they were young, so that's how she was raised. I was very much raised in a whatever the doctor says is right, and or a lot of just like bad science on like everything in our house growing up was fat-free. Because
Right,
back in
because
the 90s, everything was fat-free. Fat was like the boogeyman that was going to make everybody unhealthy.
well, and there's actually in the Tuttle Twins Guide to True Conspiracies, there's actually a chapter on how Big Sugar essentially like bought the science to blame fat for what sugar was
Mm.
responsible for. So, I mean, it wasn't even just bad science; it was like manipulated, evil, bad.
Yeah, well, it's like the high fructose corn syrup thing. Like, why
Hmm.
is corn syrup and everything? Oh, because we have money in corn, and so it's crazy. And like I said, back when we were younger, we couldn't go on the internet to see if something was wrong, or we couldn't really second guess it or check it. There are probably alternatives, like books available, but even then, I don't think people or kids realize today that getting a book published wasn't as decentralized back then either. You had to like have a publisher. Literally now anyone can publish a book. It's great. It's so cool.
Hmm.
But you couldn't back then, right? So it would have been really hard. But flash forward to today, I think it's really interesting how far we've come. And COVID was a big example of this. Now, I'm somebody who for years and years now, goodness, like 15 years now, have been very skeptical of government and of the healthcare industry in general, because I think a lot of times it's incentivized to keep us sick because there's more money in sickness,
Mhm.
and just, government gets involved and things like that. And so I have, for the last 15 years, been really big on trying to find this alternative information. But COVID was really interesting to me because we were only given one narrative, right, in the mainstream media, and that was, well, it went back and forth. First it was masks were bad, they're good, then they're bad, but we were given all this information. We were given these, brand new vaccines that haven't been tested and they're brand new. They're fine. You shouldn't worry about them. But then you had podcasts like Joe Rogan, for example,
Mhm.
who was presenting all this really interesting alternative information. And here's the thing, you don't have to agree with it. You don't have to believe
Adopt
it
it. Yeah.
or adopt it at all. But the fact that it was there is so amazing, because we didn't even have that when you and I were growing up. You didn't really have a way to learn anything else. So, or easy at least. So
Mhm.
it's so cool to me that we have this. And there are all these, like there were two doctors. There was McCulloch, and I can't remember the other one that Rogan had on, that were just giving so much information during a time where I think people were very scared to question the government's narrative on
Mhm.
COVID. And we look back and, like, even people who bought into it, I think they're like, oh, this is so silly. Like, the viruses weren't going to spread if we stood 6 feet apart. Like, it was just, everything was so
Right.
silly. But we had this decentralized information where doctors were able to go on independent media and talk about this. People like Andrew Huberman. I don't know if you're a fan of him or not, Katie.
I'm not super, super familiar. I'm like peripherally familiar.
Okay. He's a neuroscientist who teaches at Stanford, but his big thing is, he's like, why do scientists gatekeep all this information when we have podcasts now? Like, why aren't we sharing all the information? And it never follows one narrative, and that's what I really like about it. He has doctors and experts on from all different types of, one, like mental health, respiratory system, immune system, sleep, water, all these different people. And he just asks them questions. And he's also very knowledgeable. He is a scientist himself. But I
Mhm.
always laugh. My friend and I call him the killer of fun, because I'll be like, oh, my water filter is probably doing the job. And then I listen to an episode. He's like, you probably don't want to hear this, but your water filter isn't doing the right job. You need to get
Like,
this water filter. And I'm just like, oh no. So, but but it's available, and it's out there. And it's so cool that I can go onto an episode. Like, I think I was, when we were both sick recently, and I think I was telling you I was taking this supplement I love called NAC, and
Mhm.
how it helps get you over colds quicker and flus quicker, and can prevent some stuff. And I learned about that because of a Huberman episode. And so things like this, where I'm able to get this information that I couldn't get anywhere else, I just think is so amazing. And I think it's one of those things that shows you that people think the world is getting worse all the time, but there are a lot of ways in which it's getting better. I don't know if you have any thoughts on that.
Yeah, I was actually just thinking about my own NAC journey and how I came to discover it, and
Not
it's
sponsored by NIC, by the way.
yeah, we're not,
Right?
but it's interesting, and it made me think of something else. Like, even as we're happy that we have these big podcasters and people like Rogan and Haberman, or this is great. But there's another side of it that's really cool too. And it's that we have access just to other people like us who we didn't have
Mhm.
access to before. And so we have seen how these bigger accounts, they can get deplatformed, right? We've seen it a lot, especially there was this like kind of golden era, I think, during COVID, where all of these other people started putting out really great information, and then came like this crackdown, right, where
Yeah,
suddenly we had
yeah.
these misinformation experts, and we were getting told that we couldn't see things or couldn't hear things, that we weren't allowed to decide for ourselves what we thought of this information. We just weren't allowed to hear it. So then that happened. And when that happened, I had some really cool experiences where, so I used to do the social media for the Tuttle Twins account. And with that, some people would like find out that I was doing the social media, and then they would start following like my personal social media accounts. And so I got to meet some really cool people through that who were aligned with me, I guess maybe like through my politics or, my economic worldview or whatever. And so I had a friend that I made who liked the Tuttle Twins, started following me. We started talking. She's a functional medicine doctor. And she is the one who introduced me to NAC. And so it's really cool. Like, you meet people now through, you follow the same bigger accounts, or your paths cross somehow in the, world of online life. And then you're able to connect with people who are like you in a lot of other ways also. And then you can share information with them. Like, I think that's so cool, because so many of the things that I've learned about health have just been from like other moms or other people who have said, "Hey, I'm experiencing this and I found this and it works great." And you're like, "Oh, well, I've never seen that before. I'm going to try
Yeah.
it too." And that's such a cool aspect of it. Like, there's nothing more decentralized than that.
No, yeah, no, absolutely. And this is on a little bit of a different note, but even things like I'm really big into skincare because I'm getting older. You kind of
Same,
have to
same.
be.
We'll
But
talk
it's
after
been
the show and
cool.
you can tell me all your
Yes,
products.
secrets that I've been able to learn through things like Instagram Reels or even like TikTok. And I know a lot of people have
Yeah.
issues with TikTok, so if you don't want to be in it, totally understand. But just little things where it's like little snippets of health information.
Mhm.
And then of course, like, we talk about this a lot on this podcast. Is always I go down a rabbit hole and I research for myself, right? I think that's the most important thing. But even
Mhm.
being exposed to this, like before I started taking that supplement NAC, I went and I did hours of research on it, and then I felt comfortable
Right.
taking it. But I wouldn't have even been sent down that route if I didn't know it was available to me. And so I think about how lucky we are, because even like when I started doing keto or higher fat diets, because I thought they were better than the no fat thing. I found those out from social media, and I found that when I was able to Google and then listen to podcasts. And I think we're just really blessed to live in a world where this health information is so decentralized. And I think it also threatens the establishment elites too. I think we saw this towards the end of COVID, where now people are starting to see like, oh, maybe that wasn't correct. Maybe there were other things out there. Look at like ivermectin. People were saying it was, horse paste or whatever, but ivermectin actually won Nobel Prizes and
Right.
was known for helping people, called a miracle drug for a while. So really important. I think the takeaways from this are two things. One, to think of like the good things that are in the world right now, because I think we focus on the bad too much. And I think the
Mhm.
decentralization of healthcare or health information is so important and so great. And second, to remind you what is available out there, that you can find all this information just by Googling. And it's so amazing. So we will leave it at that. Don't forget to like and subscribe to the podcast. And until next time, guys, we will talk to you later.
Bye.
You've been listening to The Way the World Works. Make sure your family is subscribed and check out TuttleTwins.com for more awesome content.